So, dear colleagues, welcome to this press conference to go over the COVID-19 situation in Quebec. The Deputy Premier of Quebec and Minister of Public Safety, Madame Geneviève Guilbault, together with the National Director of Public Health of Quebec, Dr. Horatio Arruda. Madam Deputy Premier. Thank you very much, Mr. Gagnon. Hello, everyone. So I am going to start by thanking the people who made the mask that I'm wearing today. Nathalie and Stéphane from Vêtements Sport Apogée, done here in Louis Hébert in my own writing. So thank you very much. And thank you to all of our entrepreneurs who are making masks. And I would wish to make an important reminder today on the importance of wearing face coverings. It is very important that everybody develop this new habit, this new reflex of wearing a face covering when you leave your home, particularly when you wish to go to a place where physical distancing is more difficult, for example, public transportation or businesses. So it's a new habit that we're going to have to develop and cultivate. It's not instinctive for us. It perhaps doesn't come naturally for us yet to wear a face covering when you leave your home, but we must absolutely develop that habit. It is a habit that is going to be there with us for a certain time, at least over the next few weeks. So I would invite you to do what is being done in our Quebec companies. There are many Quebec artisans who have started producing face coverings, homemade. Some of them are very beautiful, like the one that I'm wearing today. So have a look at what is being done. We can also encourage our entrepreneurs by purchasing locally and protecting others, because as we often know, wearing a face covering allows us to protect others as well, the people around us. So I'm going to go to the day's numbers. So today, 71 new deaths are being reported for a total of 3,718. I offer my condolences in the name of the entire government to the families and loved ones of these people. We now have 44,775 confirmed cases. That is an increase of 578 cases. It is also important to say that we have 12,822 cured people. 183 people are in ICU, an increase of 3. And we have 1,516 people who are hospitalized. That is a decrease of 20. And I wish to bring a clarification on the number of hospitalizations, on the variation in the number of hospitalizations, which is today of 1,516, whereas it was at about 1,700 or more yesterday, from what I recall. So we have the number now of people who were treated in non-hospital settings. So we have removed those people from the list because they were treated in places that are not hospital centers. For example, in convalescent centers or readaptation centers. So we have about 200 people who were treated in those circumstances, which makes it that we remove them from the list, and that means that there's a variation in the number compared to yesterday. So generally speaking, we continue observing an encouraging trend, but a trend with which we must keep being prudent. Yes, we can be happy, but we have to understand that this trend, which is showing itself to be encouraging, is still thanks and is still dependent on the sum of all those little daily things and gestures that we have every day in order to decrease, to stop, to break the spread of the virus and of contagion. So it is not time to stop. We say it very often, but it is so important. In these difficult times, we try to hold on to that hope and good news. So there is that encouraging trend, but we can't slacken our vigilance because it always depends on what it is that we do and what we will continue doing. So if we wish to continue going in the right direction, we have to maintain those good habits of physical distancing, of hygiene, and wearing face coverings as well as much as possible. This being said, we are very conscious, and now I'm very conscious of the fact that after 2 months, it is becoming more and more difficult to be as disciplined, to be as respectful of the rules. In particular, as the summer is coming and with the beautiful weather, we miss our friends, our loved ones, our family members, our children, our parents, our grandparents. And it ends up being hard to keep one's spirits up, and we're very conscious of that. It is the reason why we have thought together with public health about a way of finding some way of easing up on the rules around gathering. And we had to find a way to do so without compromising or putting in peril the health of Quebecers, because we must remember health, your health, the health of all Quebecers will always be our number one priority. But we had to try to find a balance. And the last time that I was here, I remember that we had announced our action plan in mental health by saying we have to find a balance between the efforts that we're investing to protect our physical health and the efforts that we're investing to protect our mental health. So we had to find that balance between the fight against the virus and the fact that we want to go back to a more normal life. I'm therefore happy to be able to tell you today that public health has given us the green light to go forward with certain easing measures as far as gatherings are concerned, and I'm talking here about external gatherings. So as of Friday, the 22nd of May, in 2 days, it will be possible to have outside gatherings that will be restrained to certain very important conditions. First, those gatherings outside will have to be a maximum of 10 people. And those gatherings of 10 people maximum will have to include people coming from the maximum of 3 households or 3 addresses, 3 families, call it how you will, but 3 units or cells of people who usually live together. So 10 people max, coming from 3 different families max, and always outside of your home, of your house, of your apartment, whether it be in your courtyard or in parks or other spaces. But we are thinking more specifically to, maybe barbecues or the wish that we have of being able to invite people over to our home. This means that you could, for example, a family could invite friends over from 2 other households. They could invite them to come to their courtyard or their backyard, as long as there are no more than 3 families, no more than 10 people, and while keeping as much as possible that physical distancing of 2 meters. That is also very important. So outside, physical distancing, 10 people max, 3 families or households max. That also means another example that children, because we heard, that cry from the heart from children who want to be able to socialize outside of video games and screens. So children from 3 families could get together and play in, the backyard of one of those families or on a side street or an alley. So they could play together. So that's good news. However, it has to be understood that it's the same principle. As we announce a new advancement, if you want, another step towards a more normal life, we have to remain scrupulous on the other guidelines of public health, because when we make such an announcement, it's a test. When we announce new possibilities, it's a test, because after that we have to see the effects that it will have on the curve, on the contagion, on the network, etc. So every time we announce these new possibilities, it is good news, but we absolutely have to bring them back with a strict respect of public health. We have to continue washing our hands. We have to continue being 2 meters away as much as possible, and we have to wear a face covering. Still, this is good news. Of course, when we think that some people might have other people go into their backyards, we ask you to try to keep that distance as much as possible, but we have to be realistic. It's obvious that at one point somebody might have to go inside to go to the bathroom or something. If there are very young children, somebody might have to go in, to change a diaper. There are situations like that are obvious and that will require perhaps going inside. But please, we ask you to avoid gathering inside. We're not there yet for the time being. So for the time being, we're testing things out for the outside. Under reserve, I was saying of certain things that it just makes sense, the fact of taking your child to the bathroom. But avoid going inside. We are not yet at the stage of being able to authorize parties, gatherings in basements, or family dinners inside homes or apartments. We're not there yet. We ask you to please keep to outside gatherings, 10 people maximum, 3 households maximum, by respecting as much as possible the 2-meter distancing, and to avoid, because sometimes a Friday or a Saturday night we invite people over, and as the evening goes on, it starts being dark, and sometimes it's cold, and you want to go inside. But please Don't succumb to that temptation. Right now, we have to stay outside, and when it's done, we all go home. We'll see the effect that it has, and we will see possibly eventually the possibility of being able to do it inside. But for the time being, we're announcing for the outside, which is already very good news because it will allow us to see our friends and our family and to take advantage of the beautiful weather. We felt that this was very widespread as a wish. There are already a lot of people taking advantage of the outside. It's starting to be super nice, and it's going to be nice over the weekend. So you will be able to take advantage of this beautiful weather and take advantage of the people around you, and that will be really good for everyone because, as I was saying, after 2 months of being confined, that's where we are now at. We also have another announcement to make today. I won't go into details right now, but I'm just going to give you a general overview. Another good news that is going to make Quebecers happy. Public Health has also given us a green light to progressively reopen everything that has to do with body care, private health care, or, we're thinking about dentists, clinic, we're talking about hairdressers that will be able to open eventually. The dates that have been chosen as of now is June the 1st for private health care in all of Quebec, and as far as beauty care, body care would be the 1st of June outside of the Greater Montreal area and Joliette area. So the date for the reopening of those companies that give body care and beauty care for the Greater Montreal area and Joliette are to be determined. But we already do have these dates. So we just wanted to give you that teaser. And what is encouraging is that we heard a lot about the impatience or people who are really looking forward to be able to go to hairdressers, for example. So it will be good news that will be quite welcome today. And it is my colleagues, the Minister of Health and the Minister of Work, Madame McCann, and Minister Jean Boulet, who will give the details this afternoon with all the details. So, all of those nice announcements today, I repeat it, depend as well on our ability to maintain our good habits of distancing and hygiene. Because if contagion starts again, if we were to see undesirable effects to the new possibilities that we're giving ourselves, collectively we'll have to take a step back. Remember that when we announced, the date in the regions, we had certain dates for schools and daycare, and we had to, since then, push back certain dates in Montreal for businesses and schools, etc. So when we feel that it is necessary, when public health feels that it's necessary, we don't hesitate in taking a step back or modifying dates because health is the priority. So the best way that our investments will continue being profitable is to continue investing in prevention and in protective measures, distancing, hygiene. I also want to go over the vacation of our nurses because there is information that has been spread around about this question that were broadcast yesterday, for example, on the vacation that our nurses will be able to take this summer. So I want to be very clear on that. Our nurses are going to be able to benefit from rest that is very much warranted this summer. There is no question of preventing our nurses from taking time off, but we are going to favor 2-week periods, and the facilities are going to have to make sure that they keep giving the services everywhere. We can't allow us to have any breach of service. Already, the staff is already an issue. That's not a secret for anyone over the past few weeks, so there is no question of preventing vacation. We'll do the very maximum to make sure that our nurses can have vacation, and in cold zones that those vacations will be able to be managed the way that they usually are, according to agreements and rules in collective agreements. So I wanted to make that clarification because it is important that our nurses know that we are very conscious of the fact that they very much deserve this rest. And we want everybody to feel as good as possible for this fall to take care of those vulnerable amongst us. For my daily thanks, I would like to come back to wearing masks. And I would like to thank once again all of our Quebec entrepreneurs. I already said so right off the bat, but I really wish to thank in particular those who didn't necessarily have the habit of producing this kind of product, so who are a little bit, changed their habits very quickly and who adapted themselves quite spontaneously to the needs that presented themselves, with the fact that we now have to wear face coverings. So seamstresses, companies that started making face coverings for citizens and who are creating very beautiful products and at different prices. So some are accessible depending on needs and interest for all sorts of people. So we had that need that presented itself that we couldn't have thought a few weeks ago. That required people who could adapt themselves, be creative, and produce things quickly. And that is what our entrepreneurs have done. And beyond these thanks, I really wish to make a shout out to everyone. Look at everything that's being done here. Look at the face coverings that are made by our Quebec artisans. They're very interesting products. And more broadly, make sure that you use the face covering and develop the reflex of using it as soon as you leave your home. Beyond the question of being mandatory or not, it really is a reflex and a habit that we have to develop. We're not used to it. We know it's weird the first few times, yes, but we have to develop this habit. I was reading this morning an article that said that in Quebec City, amongst other places, people weren't very used to it, didn't wear it much. So I would like to call out the people of Quebec, please develop this habit. Get a face covering and get used to wearing it. There are very beautiful ones out there. So sometimes, if people have issues where they want things that are more coquettish, I'm sure you'll find something that is really nice in all the beautiful products being created here in Quebec. Thank you to our entrepreneurs, and please start developing that habit for those who have not yet done so. I would like to end by saying, as always, do not slacken. It is not time to stop with our efforts. On the contrary, it is time to, yes, take advantage of the new possibilities offered to us. For example, as of Friday, so already think of who you will want to invite first for your first gathering of max 10 people and 3 households outside and 2-meter distance, but continue being respectful of the rules, continue doing the very most so that everything that we're investing as a collective effort to be able to gradually go toward a normal life, well, that it be able to continue be fruitful and that we can continue gradually finding this life that is as normal as possible. So don't stop. We're continuing and take advantage of the beautiful weather over the weekend and over the next few days and with your friends as of Friday. Did you wish to say a few words in English? Yes.
Good afternoon. I know it's getting harder and harder to stay disciplined after more than 2 months, especially with the coming summer. We miss our friends, we miss our families. That's why I'm very happy to say that public health has given us the green light to allow outdoor gatherings under certain conditions starting this Friday. First, the gathering should be limited to a maximum of 10 people. And that should include people from up to a maximum of 3 households. We're not yet allowing indoor dinners with friends or parties. The situation remains fragile and we must remain cautious. But for now, it will allow us to see friends and enjoy the good weather that is coming. I think it will all do us good. Public health has also given us the green light to gradually reopen personal care and private health care businesses. We are talking about hair salons and dentists, among other things. It will be done with special health measures to protect everyone. For private health care, it will be from June 1st everywhere in Quebec. For personal care, it will be from June 1st outside the Montreal region and the MRC de Joliette. The date remains to be determined for the Montreal region and for Joliette. My colleagues, Daniel Mécan and Jean Boulet, will announce all the details later today. I will conclude by saying that this is not the time to stop our efforts. If we continue to follow the instructions, we will continue to move in the right direction altogether. Thank you.
Merci, Madame la Vice-Première Ministre.
Thank you, Madam Deputy Premier. We are now going to start the question period. There was a first death from the Bordeaux prison from COVID-19, first inmate who has died. Is that the sign that the measures that you set up did not work. Well, first, I wish to offer my condolences, of course, to the family of this person. Of course, I can't give any details on the case in question, but in fact, there was a first death. But I've often said the necessary measures in our detention centers, in the prison system in Quebec, of course, we have challenges, in these closed settings, but measures were taken as of the beginning to limit contagion as much as possible. For example, in the Montreal Bordeaux Center. And these measures work in as far as there's only about 2% of the prison population that is infected as of now. And the number of people of infected people has decreased in Bordeaux. It was higher yesterday than today. Today we're at 60 infected people. So people are getting cured as well. So that makes it that the numbers are going down, but it is working relatively well. Of course, we can't prevent every single case. So, of course, it was predictable that there would be cases eventually, but let's remind ourselves that many measures since the month of March, visits were suspended, discontinued, sentences are being purged at home, all the activities that can take place in video conference, and those kinds of things we are doing. And there's been also a different setup to determine isolation sectors and a sector for infected people to make sure as much as possible that distancing measures are respected within those walls. So many measures were taken, and public health is also following the situation very closely in Montreal. We're working a lot with the ministry, with the public health of the local CIUS, who gives us the guidelines to apply, as is the case in all activity sectors in Quebec. It's always public health that decides on the preventive measures, the tests, and all that. There's over 500 tests that were made in the prison system. So it's going well. There are unfortunate cases, and once again, I wish to offer my condolences to the family of the person in question. But the measures were taken very quickly as of the beginning, and despite the impossibility of avoiding every single case of COVID-19, I consider that taking everything into account, things are going relatively well. And the access to individual protective measures are going well. There's no issues with that. We're talking about that last week with you as well. So the staff that has to wear equipment according to certain conditions that were determined in collaboration with the public health do have access to that equipment. So generally speaking, it's going relatively well. Do you know how many sectors in all in the establishments are in confinement? And to what extent do we fear that the cases within the prison system might bring about infections outside? Well, that is why we're trying to avoid. There are two sectors to answer your question. And the people who are in those two sectors have all been tested. So that is a point I wish to bring. So we know, about the people in those sectors, but we want to avoid people moving around as much as possible. That is why I'm saying everything that can take place at a distance is taking place at a distance. Somebody who absolutely has to go someplace, whether it be for medical reason or they must go to the courthouse, for example, well, then there's a lot of material, all the protective material that is used, the gowns and visors, etc. So we take every precaution to avoid people having to move. And when it is necessary that there are people moving around or people have to go out of the detention center, well, we have the necessary equipment to, as much as possible, limit the spread.
Madame la Vice-Première Ministre, Dr.
Madame Deputy Premier, Dr. Arruda. Dr. Arruda, question for you. Taking into account what's been announced today, and we know that Montreal is still a hot zone. I don't think I'm mistaken in saying so. We're opening businesses on Monday. We're allowing gatherings as of Friday. What is the risk that there is a new explosion of cases in Montreal? Well, the risk will be associated, very honestly, to the extent to which people respect distancing. That's one element. Wearing masks, respiratory hygiene, and guidelines. We know that certain people already gathering, and we have to make sure, that we're now clarifying the kind of gathering, so we're saying a maximum of 10, and that gives a guideline that was analyzed on the basis of everything that is being done internationally. So the number of 10 seems to be a consensus. Now, when we talk about 3 households, the idea of the bubbles, as they call it elsewhere, what I wish to say is that the households are people who live together. So a family of 4, for example, and a family of 3 and a family of 3. Those people who live under the same roof are in the same home. Those people don't keep a 2-meter distance at home, so they can be closer together. But the 3 different families have to keep 2 meters distance. In New York, we saw parks where they made circles where we really see, if people respect the 2 meters, if people, when they, see one another elsewhere, they wear masks, if the people who organize the businesses apply that social distancing, we're not in the same phenomenon as when we are inside. So for the time being, we have to take a balance, the effects on mental health of individuals, the clandestine meetings, which are, in my opinion, more problematic than a plan for a meeting. It is easier to investigate on an outbreak if we know who we're with and the families, and we look at into contrast. So the situation is fragile, but I would say that if we don't have that possibility, we're going to have negative consequences that are important in public health, and people will do it clandestinely as well. So I think that it's opening things up a little bit, but the other guidelines remain. It's not because we're opening up the valve a little bit and that 3 households can see one another outside, in their backyard or a park, that we want gatherings inside the home. No, because that is where it's more difficult to respect the 2-meter distance. You touch more objects than outside. So what I mean to say by that is Montreal remains fragile. Montreal is something that we have to go with progressively, with delays compared to other regions, and we'll be measuring the situation. And if ever we realize that people are not respecting the guidelines, well, we'll see what we do. I mean, if there are people who are going to observe, and I think that it's also going to become a certain social norm. We have to understand that we are, if we rethink dinners, for example, outside in parks or in a context that is different from what we had before, the families stay in their little islet 2 meters away from one another. And if they, come across one another, they have to do it quickly, but it's not 3 families getting together in a closed space. So we understand that it'll take 21 days before you can have a just, clear portrait of the situation in Montreal where there's more cases. Well, 21 days, we'll have indications earlier. We're going to follow the behavior of individuals because that is important. There are people who look at the data on distancing. We do surveys. Already certain people have admitted that they didn't respect the guideline of not seeing a member of the family. So we do feel that people are doing it. 21 days, the incubation period, I would say that we're going to have certain signals after 10 days that are going to be reconfirmed after 14 days, and really at 21 days, yes. But as soon as we see a certain trend or that we see that, certain things are not being respected, we can step back. And it would really be, everybody would be losing out. So I invite you to respect that and do it for yourself, for your own health, but do it for the health of the elderly and also everyone else's health. It has to become sort of like a social standard. It's not time to have parties around the pool with 30 people, in the backyard. But 10 people with distancing, it will be allowed.
Autour de Mathieu Dion, Radio-Canada.
Bonjour à vous deux.
I'm trying to find out what's changing compared to the decree that was on the 20th of March, because there already was an authorization of getting together with other people, keeping a distance of 2 meters. So basically, what are you allowing today? And from a point of public safety, how is it manageable, what you're announcing? Well, we're coming to clarify it. The decree said that you could already be in the presence outside of people if you kept the 2 meters, but we said as much as possible to avoid doing it in your courtyard or over, to make it, to not ease it, to have less than 2 meters, so that there'd be in too much closeness in a period where we couldn't allow it. Now we have much clearer guidelines, and Dr. Arruda said it, and I'm sure that we've all observed it in our own neighborhoods. There are people who are already starting to do it. We can see families that are more and more numerous, in the same backyard as the weather gets nice. So it was, we're saying, okay, it's realistic. People are tired. They want to see one another. They miss one another. It's beautiful. It's getting warm. We want to be able to get together, but now we're giving very clear guidelines. So we're saying a maximum of 10 people, a maximum of 3 households. So maximum of 10 people outside, 3 households, with distancing as much as possible when it's not people from the same household. And in this way, everybody has the same guidelines, and we know exactly what you have the right to do, and you can take advantage of things with a clear, more peace of mind. Because if people already allowed themselves to do this more clandestinely, some people didn't dare and said, well, I miss my friends. And now those people can do it openly, frankly, without getting stressed out, but still while respecting the rules, because, of course, we'll never say it enough, it's still a test. Every time we do something like that, it's a new test. So if we see that there is an undesirable effect on contagion, well, we have to come back and take a step back. And so we're asking people to be respectful. What do you answer to the request of the mayor of Oka, who wants the SQ to go into the national park to allow people to have access to it, because right now they can't do it? There are discussions that are being held right now with Mr. Simon, the Grand Chief of Kanasatake, together with my colleague from the Ministry of the Forest and Fauna, because the park in question is dependent on CEPAC, so that ministry. So there are discussions being held with also the minister responsible for Indigenous Affairs, with public health. So we are trying to see exactly what solution we could find to this problem. We understand that there are concerns in many places in Quebec and in that area for the deconfinement period that we are experiencing. But yes, we have to see how we can reassure them and how we can get to a solution that will allow us. But it's not about, preventing the access to the park. It was planned that the CEPAC parks would open on the 20th of May. It is the 20th of May, so we encourage them, or rather we discourage them from blocking the access to the park, but we are discussing right now to find solutions to this problem. Of course, we are always keep an eye on the situation in terms of public health, but it is not an issue that has to do with the Ministry of Public Safety or the SQ. It really is a discussion between CEPAC, Ministry of Fauna, Parks, Aboriginal Affairs, and Public Health, of course.
Bonjour. Yesterday,
Mr. Legault said that he was happy that the border with the U.S. remains closed, that if it was up to him, he would keep it until the end of July. Can you tell me the difference between that and people from the Côte-Nord who say that we'd like for the border, or the roadblock, rather, remain closed longer because we want to protect ourselves from people from the hot zones? On the Côte-Nord, there's been many discussions on that sector. We even have, the distinction between La Côte-Nord and Basse Côte-Nord. There were discussions that were different depending on whether you're in one place or another. And there was a modification as well of the dates. Now it's the 31st of May for the Côte-Nord. So I said so, same answers as earlier. We understand that there are concerns in certain places, and there is an evaluation being done by public health, and perhaps Dr. Arruda will wish to complete. But these are discussions. It's reassuring. It's explaining to people, but while taking into account the realities and particularities locally. In certain places that are more isolated, more vulnerable, less adapted populations, to be able to face possible contagion. So we're putting all those elements together to be able to figure them out, to take the most objective and scientific decisions possible. And maybe Dr. Arruda would like to add something on that? Well, there's a question of level. We are in the process of reopening, so we won't be able to prevent, eventually, the virus. The analysis is done according to the sanitary analysis of public health. So we're not encouraging people to move around. It's more difficult to control that at certain borders. And if I, go on with the logic, if there are cases in a street or a sub-area, we're going to people to leave from that, to leave that neighborhood if we push that to extremes. So it's a question of application, and it's also a question of where we won't be able to contain forever. At some point, and at this stage especially, and I think that there are local decisions being taken with a specific analysis, particularly when we have issues of access to care, if ever there's an epidemic, and where we can't quickly transport people towards the city. I mean, we'd love to protect ourselves from new cases, but we know that as long as we don't have medication and a vaccine, it'll be impossible. We'd love to be able to prevent every case of hospitalization and death, but it will be impossible. But it's always a question of managing risk. And there's a certain fluidity in the community that has to install itself. It really is an analysis that is done by public health in a perspective of sanitary and health capacity. Of course, when we're at zero, we'd love to keep it at zero and make sure that it doesn't go anywhere. But sometimes, when we contain things, it can enter clandestinely. So it's a balance that is made. But we haven't told people, to massively go to such and such a place if it's not necessary. This morning in the Soleil, there was the account of a person in Quebec who had symptoms who were close to COVID, and they refused testing her. That's not in the recommendations. Okay, is it because the tests are being limited for Montreal? No, absolutely not. And when I saw that, I read the article twice to make sure that I was not mistaken. So I will make the verifications. It is, there is no advice to save the test for Montreal. The quotas haven't been reached in Quebec. A certain who is symptomatic of a certain age, according to the indications. I mean, I'm going to check. Before going only on what was written in the article, I will investigate. But people who have symptoms that are compatible with COVID-19 should be tested. And also, to take charge of the context at home. So I don't know what happened here, but we'll correct it.
Bonjour, Dr. Arruda. Pourquoi la santé publique a décidé...
Dr. Arruda, why has public health decided to withdraw from the number of hospitalizations a category of patients, those that are not necessarily at the hospital, but who are having care? It is to reflect, because those people either had the disease, but they're not in acute state, so they would have gone home, let's say. They wouldn't be hospitalized anymore. If they had had a place to go to, they wouldn't have been hospitalized. These are people going back to readaptation in a certain center, for example. So in our wonderful computer system where we categorize establishments, those people stayed there, but we realized that with time there was a mass of individuals who were being hospitalized as if they were active cases, but they weren't, and who ended up, there while waiting to be sent elsewhere. So the analysis were made by the people to have a better portrait. It's not to hide anything, and that's why we're telling you, that it'll be the same method used from now on. As far as the outside gatherings are concerned, are there specific clarifications for people 70 and over? And you said a word on saying grandparents who want to go see their grandchildren. If we take that example for people 70 and over, are there any specific things? And maybe you said a word on masks earlier on. Does it mean that these gatherings for barbecue, the mask has to be worn? No, when people move around to go from one place to another, if at some point, for whatever reason, they have to stay longer, closer, while wearing the mask is an element of respiratory hygiene. First, if you're ill, if you have symptoms, don't. I mean, you have to repeat it. Sometimes people don't get it, and we know that there's a risk because there are asymptomatic people who can do it. But very often, it's people that we know, with whom, we trust on what they did before and all that. That's an element. But the question of people who are older, of course, if you are a vulnerable person with a chronic illness, for example, and you're 82, if you go outside, if you go to that dinner, for example, there is a potential with homes that you could be infected. But it's not as if you were going to go everywhere outside. If you stay in your home bubble, let's say, with whom you live, let's say, a son lives with their mother and is invited over to the sisters. Well, if the person remains in their bubble, doesn't get 2 meters less than other people, could be outside in their own bubble, in a perimeter, a zone. They could be seated, and her son might be beside her, but the other family with whom that person doesn't live, or the grandchildren who go to daycare, for example, and who work, we try to make sure that they don't come closer. This is a personal decision as far as I'm concerned. If the grandmother, and we said it, there are some grandmothers who are in really good health, they're 69, they could babysit all week, and now there's a judgment call. Is she in the same household or not? If during the week she's already with that child and has close contact, well, they could be in the household bubble. But what's important, never let it go more than 10 people, because it's a number where we feel that beyond that the interactions are difficult, and that it take place outside. And make the evaluation of your own risk as well.
Bonjour à vous. Madame Guilbault.
Madame Guilbault, we get a lot of messages from parents in Montreal who complain about the very unequal quality of the school support that the public network supplies. There's a lot of disparities between certain teachers who do a lot of interactions with their students and others who do the very minimum. And, that despite all the efforts that parents make to schooling. What could the government do to decrease these disparities in teachers or students learning? Are you talking about high school students here? No, primary school. Well, for sure it was a big challenge to set up a substitute schooling, if you will, while waiting to be able to open the schools, and it wasn't able to be done in the Montreal area. And my colleague very often says so. We count a lot on the teachers and service centers, on the schools to set up those school tools, the kits that we make available. And we also count on the support of parents to be able to help the children, especially when we're talking about primary school. Some of them are very young, 5, 6, or 7. They need their parents a lot. But the school boards or the service centers, the schools, deploy a lot of efforts right now. They had to adapt themselves very quickly to the situation. It is possible that from one service center to another, or even one school to another within the same community, there are variations from one teacher to another as well, possibly. But generally speaking, what we hear is that everybody is really doing their best to do follow-ups with the children, with the students, to be able to set up, schooling kits, and to make sure that despite everything, we continue stimulating the young ones and having an environment that is enriching and stimulating, intellectually speaking, that can also keep them busy, because a child that doesn't go to school at some point, they find that time doesn't go by very quickly. So we trust our teachers and thank them as well. If there are situations that have to be mentioned, they should be as well through the service centers. And our colleague, the Minister of Education, and the entire ministry are doing follow-ups. They're keeping a very close eye on the situation. In the MMC, for example, where schools were not able to be reopened. And if some adjustments have to be brought, they will be brought. Mr. Arruda, we realize that with today's announcements and of the past week, we are deconfining very quickly. We're in high gear. We had the impression that it's going very quickly after having been stuck inside for a long time. And we wonder, is public health, are they under a lot of pressure to go more quickly? Because, pressure from the government? Because it seems to me that we're going very quickly without even waiting to see what the repercussions are. Well, no, I wouldn't say, but we do have pressure from the populations. There are groups of pediatricians who think that we should have open schools in Montreal. We're trying to create a balance. And up until now, the deconfinement measures that we've taken, the effects are in what we were expecting, in that range. And as I say, society has to start again, but differently. Businesses have to function differently. The businesses that don't apply the rules that will be emitted by the SNET may have fines, may be forced to close, etc. So I would say that if we respect, and we've had discussions, the variation in how people do things, it's more in the distancing. If people respect the distancing, they use public transportation with masks, and they go to businesses with a mask, we will be able to function again with an R0, because Montreal is at R1 right now, and if we do things well, it can go down like this. If not, it's going up again. And at one point, we also have to take into account the real behavior of people. What is the standard that we're giving to people? Because if we do things surreptitiously, it'll be even more difficult to see so. If we realize, that it's in picnics outside that we generate outbreaks, well, we'll have to know that we had to close that. But if we don't know where it comes from, it becomes very difficult. Do you understand what I mean? So I would say that the speed at which we're doing things, it depends on many things. We could, delay it by a lot, but you're going to have very important social problems if we do that. So, social problems that we trigger cannot become superior to the disease, which in most cases, it doesn't give the same kind of problem. So we have to think about the mental health of our young people, of our grandchildren. Anyway, I'll stop with these words to be brief and short and precise. I think that it's a speed that can be seen as being high gear for certain, not speedily enough for others. We'll be measuring the effects. Just a point of clarification on the gatherings. If a person, for example, in Quebec City wants to go to Bellechasse or in Portneuf, is that authorized? Can we change regions, or does it have to be done in the same region where we live? We continue discouraging non-essential movements. Somebody from Quebec City who wants to go to Portneuf, it works. It's the same administrative region. Bellechasse, well, it's not really the same region. It's close. I mean, you have to make sure that you use common sense. But somebody from Quebec City who wants to go have a barbecue a Saturday in La Naudière, well, that's kind of far, So that person might have to sleep there, might have to go to a hotel or grocery store. That person will be leaving a trace in the community, like the same principle of cottages. If you go to your cottage, try to stay home in your cottage. So it's the same thing. If you can avoid changing region, to go from one region to another for non-essential reasons, avoid doing it as much as possible. My question now is for Dr. Arruda. I was told that an employer in Charlevoix, but it's applicable to many other people, who requires from their employees that are going to start working again over the next few days, that they leave from Quebec City and place themselves in isolation for 14 days in Charlevoix before they can start working in the company in question. First, is that legal? And second, is that a good idea, or is that an exaggeration? Or as far as the legality aspect of it, I'm not a lawyer. Maybe it's not. But Quebec is considered as being a cold zone, Quebec City. I'm not saying there's no cases. There is a little bit of transmission, but it's very difficult from somebody who in a CHSLD, say in Montreal, who was coming back in a situation where there is a history of exposure. So here I find this is where it becomes a kind of behavior which first I don't think comes from public health, that information. No, it's a company that's doing that. Well, I think it's exaggerated that people say if you have symptoms and all that, don't come. That's fine. But preventing somebody from Quebec City to go in Charlevoix and force them to go into isolation for 14 days, where they have to stay there for 14 days before starting to work again, I think that we are not, in an important difference of transmission. Those cases in Quebec were concentrated around certain establishments. There might be circulation, and I just want to say one thing. The virus is everywhere. It is lurking around. But, don't set up these kinds of measures where, it's excessive. To be able to take away people's freedoms, we have to have good reasons, and I think in this case it's problematic. You've been talking of the necessary balance between public health, protective measures, and mental health. But at the same time, you're saying that from, regional moving around, we continue encouraging people to limit themselves to essential traveling. Is that not necessary for somebody? I'll give you an example. Somebody who lives in Montreal and whose parents are in Gaspésie. Is that not a humanitarian reason, possibly, to go see their parents who perhaps are alone in Gaspésie? And as you are the Minister for Public Safety, how can the police frame that? You know, the question of moving around between the regions, but also respecting that part of this was inaudible. Are we going to create a police for 10 people? So for inter-regional and barbecues, how are you going to make sure that that this is done correctly? Well, for moving around inter-regionally, for humanitarian reasons, it's always been allowed. When I'm talking about non-essential reasons, well, humanitarian reasons is for an essential reason, and the definition of that, you know, is open for interpretation as well. We've often said that we base ourselves to the good judgment of the police officers at the time that regions were confined. It's no longer the case. So we depend on people's good faith as well. Of course, if a parent or grandparent who is very isolated in a different reason and has nobody else to help them, we already considered anyway that it was legitimate that you wanted to go help that person if really they couldn't find help elsewhere in their community. So it can be understood. The example we're giving earlier on is more, you know, if you have friends and family who live in the same region as you, but you also have another group of friends in a region that is 300 kilometers away, well, maybe you could start by seeing your friends that live close by before going 300 kilometers away. It's in that sense that I can say that certain things can be more essential than others. And as far as giving a frame to this new permission of 10 people maximum, well, the fact of putting a max to the number of people helps being able to evaluate, you know, how compliant people are in a gathering. It's easy to count, you know, it's simple math. So 10 people and less, you have the right. Beyond 10 people, you don't have the right. And here, of course, police officers are not going to start investigating, you know, private homes and knocking on doors to see people. That's not the idea, you know, to be able to find people. So we depend on the good faith of Quebecers. That is what we're saying. Even for your own well-being, that of your families, of our elderly, respect these guidelines that we ask you to respect even when we are in new possibilities like these outside gatherings. They always come together with the very important precaution of continuing to respect the measures of distancing and hygiene. So we give ourselves, you know, a service to everyone, because it will avoid having to take a step back and to reclose things down, perhaps to delay even more the possible inside gatherings, to have to delay other things that could have come more quickly had we given ourselves the means. That is to say, in respecting the guidelines. So yes, it will be simple to a certain extent to check whether somebody has the right to do what they're doing, you know, with that number of 10 that we've given ourselves. But more than anything, I depend on people's good faith. People have been exemplary, you know, continue. You know, with 10 people, you do have the means of inviting a few friends, even if you have 2 or 3 friends. So it can be very pleasant. Take advantage of the beautiful weather. Everybody's legal. Everybody protects themselves. And everybody's happy. So I understand that perhaps we're going to decrease a little bit on sanctions. Well, you know, if we're talking about private backyards, we can't just around in your home. Perhaps there will be denunciations, and as we were saying, we can't go into paranoia either. If there's 25 cars at your neighbors, and usually there's 2, well, maybe there is a doubt, but otherwise it's possible that some people may come with more than 1 car. It'll be a question of balance and common sense for everyone. So for people 20 and over, when we go to the site of the government of Quebec, it's not easy to find. It's written really small. There is an incredible, you know, copy and paste of press releases that were all just stuck together and hardly updated. I put myself in the skin of an elderly person who thinks, you know, even in Montreal, as of the 25th of May, will they be able to go to all stores or only in those essential stores? Will they be able to participate in the gatherings, and as of when? Because people perhaps have forgotten it, but for those 70 and over, it was only as of yesterday that they were allowed going back to essential businesses, and people deconfine themselves almost instantaneously. So are you going to have a cleanup in all that to make sure that the information is easier to find? for people? Well, I'm taking down that comment. It's very constructive. We will check whether, in fact, it's easy to understand for everyone on the website. But first for the gatherings. I said it, but I will say it again. The possibility of holding gatherings as of Friday is applicable to all of Quebec. For people 70 and over, I think that the question was asked earlier on. Of course, we discourage people who have a medical condition or a health condition that makes them more vulnerable to contract the virus. We discourage them at any rate from holding activities, getting together even with their families or friends, because they have to protect themselves and protect others as well. And all of the same rules are applicable. The opening of businesses in Montreal is the 25th of May, so next week, for those businesses that have a door to the outside. I don't know if I'm answering all your questions. So we have to keep the same precautions for people 70 and over. We had already announced certain easings of the rules for those people, that they could go to businesses again, that they would be able to, become more dependent as well. So it continues being applicable through all these possibilities of having external gatherings, 10 people max as of Friday, but still with that worry of protecting ourselves despite the new possibilities being announced. Did you want to add anything? No, it's fine. But somebody who's 70 or 71 who's in good health, who wants to go, buy an item of clothing in a store that has, and who's wearing a mask, and I encourage them to, wear a mask because we protect ourselves and others when we wear them. So in stores, they have set up guidelines to wash their hands. We ask people to not touch all the clothes and handle them, but really to try to concentrate and store, to shop differently. These are guidelines that store owners will have. So I think it's not illegal. We're not here, we're not trying to be ageist, but we want people to be conscious that the older they are, the more they have associated conditions, the higher the risk. English questions?
Good day. Dr. Arruda, I'm just looking at the testing numbers. You are down to 9,582 for the 18th of May. So is your $14,000 target, 14,000, did I say dollar?
Not $1,000.
Yeah.
I think it's going to be more than $14,000, the cost of this epidemic. But what I can say to you...
You seem to be way off your target.
It is. And I can say that I'm not happy of this. There is the weekend effect and the sunshine effect, because some of the people doesn't present at the same rhythm that if it was when it's raining there's a problem, but if it's too beautiful, people are not coming. So we're going to have trying strategies on this, and I hope, because I will look at this number. This is the number of the Monday, 18, if I do know, because we are going to have a delay. So I hope tomorrow I'm going to be going up. And I hope we're going to have this maintaining this 14 things. There is going to be always, I would say, some variation. It's very difficult to have 14 every time, but I want to be near of this. And soon, as we're going to have a better capacity of 17 and 20,000, I hope we're going to do that, and the machine is going to be there. But it's why this situation where there was a case which have symptoms have not been tested was crazy for me, because we get this capacity.
Second question, in New York State, they've announced they're going to be testing people before they go back to work. Do you have that capacity in Quebec? Because obviously, as of Monday, more people will be going back to work. Eventually, you will allow people to go back to work in office towers and other possibilities. So is there any plan to test people before they are admitted back to their workplace?
Not I would say sooner. I would say that, first of all, even if you are working to deconfine, I would say some sectors, the ones who can still be done by teletravail or at distance, we'll ask the employees to use that system. Only let them go to the office when necessary, with less people, respecting the thing. We can do a test today, or if it's too soon before you get the positivity test, the test can be negative, and at the same time you're already infected, but the test doesn't detect it. So the test is good. I don't want to say the test is not good, but it's not, when it's given to everybody, even if it's negative, it doesn't mean that the people who don't develop. They can be infected 3 days after, and the test was negative. Will we repeat the tests every week? So that's not necessarily a strategy. And as we got rates of transmission, but we don't have perhaps as much as cases as in New York or the transmission. If we get 5% of the population who already have made the disease, it means that there is another big quantity which are not infected at all. And so what is important, I think, is to make sure that those people respect the distancing, use the mask when they travel, to don't contaminate somebody else where they are asymptomatic but infectious.
Thank you. Samuel Pouliot, CTV News.
Hi. There's a prisoner at Bordeaux jail who died of COVID-19. Inmates were concerned about how the jail was handling the virus. What did the province do to protect inmates and staff? And will anything change in the future in the protocols to following this death?
Well, first of all, I want to offer my deepest condolences to the family of this person who died in Bordeaux. Like I already said, we have put in place a lot of measures, preventive measures, as soon as the beginning of the pandemic in our detention centers throughout the province of Quebec. So far, those measures have worked pretty well. Of course, we cannot avoid all cases because those are closed milieux d'hébergement fermés. And so it was obvious that sooner or later we would have to face some cases. But as we speak, we have 60 inmates who are affected and 28 members of the staff who are infected. So those represent about 2% of the whole carceral population. So it means that the measures that we have put in place work pretty well. We have, as soon as March 14th, forbidden all visits. We have made sure that all activities that could be done in distance, like visio conference and things like that, are done. We have announced some measure to give special temporary leaves for people for medical reasons. So we have put in place a lot of measures to make sure that everything was done to protect our staff and our inmates in collaboration always with the public health. And we work pretty closely with the public health at the local CIUS in Montreal. We have weekly, even daily conversations between the Ministère de la Sécurité publique and people at the detention center and people from the public health in Montreal to make sure that everything is done.
Okay. And about CHSLDs, if the situation in the hospitals is under control, why send patients back to CHSLDs, which are the hardest hit areas in the province? Some advocates are calling it a death sentence.
Well, people who have been infected or who are still infected can go back to a CHSLD in a hot zone because rather they are already infected or they have been infected. So the risk of having the disease again is really minimal. So it is possible to do that. And so those are types of transfer that are being done. And of course, if someone has been sick, has had the disease and doesn't have it anymore and has to be transferred, we'd put her or him in a cold zone. This is obvious to make sure that there is no contamination. So those are procedures that are being put in place to make sure that people who don't need to be in hospitals anymore can go back in their previous home or new home if she or he was waiting for a place.
Thank you. Katsune, CBC News.
Good afternoon. The Kanesatake's band council is basically turning people away, even though in theory the Oka National Park is opened as of today. You know that the mayor of Oka is asking the SQ to intervene. Tensions are high. What will you do about it? And how come we haven't seen this coming? Because tensions are high for a certain number of hours already.
There are discussions that are being held right now between the people from Ministère de Forêt, Faune et Parcs, who are responsible for the CEPAC, who is responsible for the park that you are mentioning, between them and my colleague from Ministère des Affaires autochtones and Mr. Simon, le grand chef de Kanesatake, and the public health, local public health in Laurentides, because we understand that there are issues and worries about the deconfinement. And the fact that people can come and go, including in that park, but it was announced that the parks from the CEPAC would open today, so they are open today. It is not right to try to stop people from going there. So we are having discussions to make sure that we calmly find a solution that is satisfying for everyone.
Second question.
Gatherings. There was a decree back several weeks ago allowing gatherings with people outside with 2-meter distance. Now you're putting a restriction. It's 10 people maximum. So I would like to know how come you didn't go in the same direction than, for example, Nova Scotia, who is allowing a bubble, 2 households that can be together, exclusive, but then they don't have to be 2 meters away. So how come you didn't go in that direction? And also, can we change a group of people? Like in Quebec, if I'm choosing those 9 people and finally I say, okay, well, they're not that funny, can I change people? Okay. Can I move around?
Okay. There have been a lot of discussions. You know, there is no science on this. There is different experiences, and we looked at what was been done in New Zealand, Belgium, and that bubble issue. If we understood that telling that you will only meet with this, you've got 3 brothers or 4, and then you decide to keep only this one and not the other one, that will make some tensions in families, you know, because it's not your neighbor. You can have so it's going to be dividing families, right? And what we do respect is it could be sometimes not families, and could be students, co-locators with friends that are used to. I think we suggest that it stays the same group for 2 weeks, right? And then, because if you change every day, okay, you're going to be mixing up a lot of contacts. So I think try to find out the persons the more significant to you. Okay? First of all, it's easier if you know the persons, and then you can change. Yes, you can change. I hope. I don't know. Perhaps we won't meet every day because everybody has to work and somehow. But you know, try to be as stable as possible. But you can change. You know, if you had a dispute with your sister and don't want to see her anymore because you are all stressed, you can change to another one. But we didn't want to have an exclusive bubble. I think we would have introduced too much tension, because why does she ask me and don't ask me? You know that, and this have all been discussed with a lot of people trying to find the best model. There is no right answer. There is no perfect situation. But this is a guideline that we think could probably let people have some back to social contacts without creating more problems because of the choice of the contacts, and trying also to not to being every day meeting every different bubbles of maisonnage, because then you're going to expose the risk of getting the disease by an infected person who don't have any symptoms yet.
So I know we're running out of time, but we have 2 last questions from Raquel Fletcher, Global News. Why is Saint Anne Hospital not allowing family caregivers? A woman whose 97-year-old mother lives there. She says she's had training and she is still not being allowed in.
Well, it was said that significant caregivers could go back in residences, but if a residence doesn't want to welcome caregivers for any reason, they have to ask the permission to the Ministère de la Santé. And for some residences, they have got this permission because they had good reasons not to be able to welcome significant caregivers yet. So we would have to check. I don't have the information whether this residence is among the residences who have got that permission, but we can check and get back to Mrs. Fletcher. Unless Dr. Arruda has the
that's
answer.
exactly the case. Sometimes now they cannot decide it by themselves. There used to be some situations where there is an active outbreak or something not in control, but we will check that situation.
Thank you. And as a very last question, Global News is doing a story today on the city of Dorval giving masks to all residents over 70. Not all cities can afford to do that. As we reopen more and more, how can we make mask distribution more equitable?
Well, this is a really good question, really pertinent. And the Prime Minister has already announced that we would give 1 million masks in Montreal, and we will also give masks in the city of Laval. So we already made that kind of decisions for some cities. We will have to look at how the situation evolves. If there are some needs elsewhere, we can address that question when it comes.
So thanks for your time. C'est ce qui complète pour cette conférence de presse.
This puts an end to the press conference. See you all soon.